Hey there, Brew Crew. So, quick question. When was the last time you blinked? Well, if you can't remember, I'm with you. If your eyes are dry or they're tired or you've caught yourself squinting at your phone for hours on end, this episode is for you. Today on Morning Brew, we're joined by ophthalmologist Dr. Stephen McNutt. And y'all, he is here to open all of our eyes, literally and figuratively. We're talking about screen time strain and how all this scrolling is impacting our vision. And trust me, it's more than just a little eye fatigue. Then we get into something wild, how your eyes can actually reveal signs of serious health issues like diabetes and high blood pressure, even brain tumors. It's fascinating stuff. And finally, if you've ever wondered how LASIK or cataract surgery really works, Dr. McNutt gives us a behind-the-scenes look that may just leave you seeing things more clearly. So if your eyeballs are ready for some TLC, just grab your coffee, maybe blink once or twice, and let's dive in. Everybody, please help me welcome Dr. McNutt. Good morning, Doc.
Hi, good morning.
Thanks you so much. Yeah, absolutely. You know, such relevant information because all of the science has just told us we need to get off of the screens and put the blue light down, and we just hear about that all the time. So I want to dive into all of that, Dr. McNutt, but first I want to talk a little bit about you. Tell us a little bit about your background and what was it about eye health that made you want to become an ophthalmologist?
Starting with the tough questions.
Yeah.
I grew up in the Northeast, ended up traveling all around. I played hockey in Alberta for a year.
Wow.
And then made my way to Cleveland. I did my training at Cleveland Clinic and then moved to Laredo and been here about 9 years now.
9 years already.
Time flies.
It does, and I've interviewed you before. We've done several news stories with you before, and you've got a very interesting family because everyone in your family is just a brain. I mean, from one sibling to another, your parents, you guys are really smart.
Yeah, I don't know what happened to me. Yeah, my dad's a physicist. He works on rockets that go to different planets and stuff like that. My mom's a vet, so I think I took more after her. And my brothers followed in my dad's footsteps, and they're astronautical engineers.
That's amazing.
And I've got some pretty smart kids too. So
yes, you do. You do. So what was it about eye health? I mean, you obviously went down the medical road, but why eyes? What was it about eyes?
I think you just fall into a specialty, actually. So I played hockey for a long time, and I thought I was going to do orthopedic surgery. You kind of fall in or fall out with a particular group, and I think I found ophthalmology fascinating because I like small things. I like to do surgery, but I also think that a lot of, and we'll get onto this later, what you can see in the eye and how you can diagnose other things through the eye is pretty fascinating to me, and so it definitely is a window to your health.
Wow. Yeah. So how long ago have we all been staring at our screens? When did you first, as an ophthalmologist, when did you start seeing this trend and start realizing that, hey, Houston, we might have a problem here?
We're very reliant, obviously, on our phones, and I'm a culprit of this too, right? I stare at my phone all the time. It definitely affects our eye health. I think we weren't built as humans to stare at computer screens, to stare at phones. For that matter, we probably weren't, built to stare at books too, but we adapt. Unfortunately, for our eye health, we tend not to blink that much. We blink about 50% of the time that we should when we're staring at our phone or even driving for that matter. And so the eyes tend to dry out. And so that can most definitely affect, how we see, but also, cause longer term issues as far as dryness and irritation and discomfort.
What about the blue light that we hear about a lot? Should we all be wearing the rosy tinted or yellow tinted glasses when we're staring at a computer, even our TVs?
That's a good question. The American Academy of Ophthalmology says that it's okay not to use blue blocking glasses. And so I think that's like the hard line in the ophthalmology community. I think that there's probably something to say about light and our circadian rhythm, like how we're able to sleep. And so I think if you're staring at your phone late or staring at your computer late, oftentimes that can affect your ability to go to sleep. And so I think for those reasons, it probably makes sense to turn your phone off about an hour before you go to bed, at least. Yeah.
Okay.
And again, I'm a culprit.
Yeah. Yeah, we're all pretty guilty about that. Yeah. Is there a difference, though, Doc, about kids and blue light or screen time and adults?
Yeah, it's also a good question. So I think that, I don't know. As far as blue light and kids, I'm not quite sure of the answer to that question. I think that everything in moderation is reasonable. We know that kids that read a lot and do a lot of up close work tend to have more nearsightedness. And so I think it's absolutely reasonable to, if your kid's on an iPad or on a, screen up close, to give them some time, 30 minutes if that's something that as a parent you think is reasonable, but also make sure that they're going outside and spending time looking off in the distance, because there are some studies that show that a couple hours a day of outside time decreases the rate of that nearsightedness, because as our bodies develop, our eyes change shape too. And so as we're kids, the eyes will get longer and that will cause you to be more nearsighted. And so spending that time outside actually decreases that drive.
Okay, so definitely need a little bit of outside time.
I think it's great, just all around. I think it's good to just for our developing brains to turn off from phones too, outside of the eyes.
Absolutely. Now, we first started talking a little bit about dry eye. I have friends that have really severe dry eye.
Yeah.
What are some of the things that we can do to fix that? I know there's drops out there, but
There are.
What else can we do?
Unfortunately, dry eye is a really simple name for a very complicated disease. And so there's more to just like lack of water, because you might find, or I might find, that my eyes water when they're dry. And so then are they dry, right? I think it's more inflammation on the surface of our eye. And then we as docs, as optometrists, ophthalmologists, and what have you, need to look and try to figure out what the cause of that is. And there's so many different things that can do that. Oftentimes it has to do with the oil glands on our lids. Sometimes it has to do with the lack of water, and people with systemic disease like rheumatoid arthritis may have less water on the surface of their eyes, and there's ways to treat that. So a lot of it depends on what the cause is and fixing the cause. But lubricating drops can help, but sometimes they don't. And if that's the case, then seeing your eye specialist is important.
I'm going to ask a question for all my contemporary ladies out there who wear makeup. Sometimes, just out of the blue, the eye just starts watering.
Yeah.
And I haven't done anything, I haven't poked it, nothing at all, but it just starts watering, and all the black makeup, all the mascara, everything starts making me look like
mascara.
I know,
Yeah.
and eyeliner, it just starts looking like a raccoon. So, but I don't know what I did wrong or anything.
Yeah. Again, I think it gets back, there's a lot of different things that may be the cause of that. One important thing for women that are wearing, that wear makeup, is to minimize the amount of makeup on your waterline.
Okay.
Because those glands that I was talking about that help to make the oils that keep the tears stuck to your eye, they open up right there. And if you're blocking it with makeup, then obviously they can't do their job.
That's going to clog it up. So that's the inside of the bottom.
The waterline, right?
The waterline,
Yeah.
okay. I didn't know it was called the waterline. Okay,
Yeah,
inside.
so just the top of the eyelid there.
Okay, note to self, eyeliner on the
I
outside.
try to keep my makeup off of there too. Yeah.
Well, definitely, that was something I know, a very personal question, but thank you for answering that. So as far going back to the screen time, is there an age where we should keep kids away from screen time? Anything you recommend?
I don't know
you're
if I
a
want
parent.
to touch that one with a 10-foot pole. Yeah, I think that I think everything in moderation. Obviously, the later that you can, and I'm not a child psychologist, but I think the later that you start a child on screens, the better. And I think that there's probably brain circuits that are developing in those kids outside of the eyes that if the longer you can wait, the better. Yeah.
Okay. Well, note to parents out there, straight out of the doc's mouth.
Again, easier said than done. Yeah.
It is.
I've got 3 kids who are on their iPads.
And as an eye doctor, as an ophthalmologist, I'm sure you're just wondering what's happening to their eyes. But
yeah, I think from the eyes, honestly, from the eye perspective, it's probably not a big deal as long as they're spending that outside time. But I think more from the brain perspective, I think it's important to delay iPads and minimize it as much as possible.
Okay, good advice there. All right, well, when we come back, we're going to take a quick break, but Dr. McNutt is going to share how your eyes can do more than just help you see. They can actually help doctors save your life. So we're going to talk about that. Don't go anywhere. Here's a quick word from our wonderful sponsors.
Why pay a monthly fee? Free checking at IBC.
Welcome back, everybody. Thank you so much for sticking around. We have got such an interesting topic. We're talking about eye health. And, eye health is so important, and I am so glad that we've got an ophthalmologist, Dr. Stephen McNutt. He's joined us for this episode of Morning Brew, and we first started talking a little bit about screen time and blue light and eye health and dry eyes. So really great first segment of Morning Brew, but now we're going to get into how your eyes are actually the window to the rest of your health. So it's a very fascinating concept that your health can be diagnosed through your eyes. And I you know, when we talked a little bit about that, I thought that was something definitely I wanted to touch on. I want to start off, Dr. McNutt, by you just giving us a quick explanation of the difference between an optometrist and an ophthalmologist.
Sure. So we're teammates. I think it's very important, especially in this town where we're underserved, to have as many eye care providers as possible. There is a difference, and it basically comes down to training, how we train, and it's different. So ophthalmologist goes to med school for 4 years, and then we do residency training for at least 4 years after that. Optometrists, and then after that we can do surgery, we can do medical management of eye issues. And then optometrists tend to do more medical management of eye issues and glasses as well. And they spend 4 years in optometry school after college.
So when somebody asks you in your clinic, or they just run into you at the local grocery store and they're like, Doc, you know, I want to go see you because I'm looking for a good pair of glasses. I think I need an exam. You come out and you say, you know, I mostly focus on diseases of the eye.
Correct. Yeah.
Okay.
I tend to, at least now, because there's such a demand, I tend to work on more surgical cases in this town. Some ophthalmologists will provide glasses as well, but we tend to defer to the optometry teammates in town to help out with that.
Okay, so and I am a guilty person of one time asking you about that as well.
It's all
Glasses,
good.
yeah.
Yeah.
So I'm talking from experience here, and you were so eloquent when you explained to me, you know, the difference of the two.
Sure.
So, on that note, the diseases that you are able to diagnose through eye exams.
Yeah, there's a lot, and I think this is one of the big draws for me into ophthalmology is that you can actually, you know, be a bit of a detective and help people figure out issues that are going on, not just with their eyes, but with the rest of their body and their lives. And so the big thing here in Laredo is that we have a lot of people with diabetes. And so diabetes definitely affects the eyes. It affects the eyes, but we can also use an eye exam to see if people and make the diagnosis of diabetes, and then work with primary care docs in town to make sure that they're being treated adequately. So diabetes, high blood pressure, glaucoma is not a systemic disease, but it's a disease of the eye that can affect the vision. We have, like we were talking about earlier, diagnosed brain tumors in people from their eye exam as well. And there's things that you can see when you look in the back of the eye at the retina and the optic nerve and the blood vessels that you can help to kind of put those puzzle pieces together and make a diagnosis as to what's going on.
Well, that was my next question.
Yeah.
How does a simple eye exam with you lead to a diagnosis? What are you looking for? What do you see in there? Like, for instance, diabetes. What do you see in the back of the eye that triggers?
That's a great question. So there's different parts of the eye. Diabetes tends to affect the retina, which is in the back of the eye. We can see bleeding in the back. Sometimes we can see swelling in the back of the eye. We can see little changes from lipids that get into the retina too. So there's these little signs that we learn through pattern recognition to figure out, you know, what's going on systemically based on the eye exam.
Okay, so that would be for diabetes.
Correct.
What about high blood pressure? What do you see for that one?
So similar things, but it's mainly within the vessels. And so oftentimes you'll see thinning of the arteries in the back of the eye. And the beautiful thing about the eye is it's the only place in the body where you can directly view a blood vessel and a nerve. And so we can see them, and we can see those small changes that are occurring there, and again, work backwards and figure out what's going on.
Okay, and then lastly, the tumor.
Yeah, the scary one.
Yeah.
Yeah.
Very.
I think that a lot of people are concerned that something big is going on when they have eye issues, and it's very rare. But yeah, so the optic nerve is an extension of your brain, and we can visualize that when we look in the back of the eye. And sometimes you can see swelling, or you can see atrophy, the change of color of that nerve, and that can give us clues. And then when we see those changes, oftentimes we'll lead to other imaging, MRI or a CT scan to see what else could be going on.
And these are things that you've seen with
here.
patients. You've been able to diagnose these things.
Yeah.
And if they're caught early, they can be treated, of course.
I think a yearly eye exam is reasonable for anybody because there are a lot of things that we can find. And again, it can be a window to your overall health. And so, there are things that that eye exams can pick up on. Again, I'm not, it's not to scare anybody into doing anything or being concerned that they have a brain tumor, but you can definitely find things on eye exams to make sure that the rest of the body is healthy.
You talked a little, you mentioned just right now about how often you should have a thorough eye exam. You're an adult ophthalmologist, but there is a specialty of pediatric ophthalmologist.
Correct.
But can one go to the other, or do you really stick to the age group that you've been trained for?
I think it's preference. I appreciate doing older eye exams. I have kids, and it's tough for me to I love kids, but it's tough for me to treat kids just because there's definitely an emotional component to it too. But yeah, so pediatric ophthalmologists tend to take care of younger kids from 0 to 18 years. And then 18 and up is what I tend to see. But we're trained as ophthalmologists to see them all. We've done rotations in pediatric ophthalmology too.
Okay. Yeah. My son had gone to visit with a pediatric ophthalmologist. He had some eye issues growing up. And yes, we were politely cut off at a certain age.
18.
Yeah, a certain age, and then kind of just referred to go to a adult, grown-up ophthalmologist.
Yeah, just like pediatrics, kids are changing and they're growing, and when they grow, the eye changes, and there's milestones for for eye health too, and the eyes change up until probably after 18, probably closer to your early 20s, and so those docs are very specialized in making sure that you get the most out of your vision up while those changes are occurring. And so,
yeah, I think he needed to wear a patch. He was also having drops in his eye to strengthen the weaker eye, and all of that was done in an office in San Antonio because Laredo does not have a pediatric ophthalmologist, so we needed to travel for that.
That's correct.
But with just exams and, of course, adults, you can certainly take care of those issues.
Most definitely. And again, in a pinch, we can see a pediatric or a kid. That's not a problem. It's just that we tend to focus more on the older stuff.
Yeah, absolutely. Now, when you do, are there diseases, or tell us the diseases that you specialize in, and how can they be
For me, mainly cataract
treated?
surgery. Again, I think that where Laredo is, and there's a huge need because of the amount of diabetes that we have in this town, unfortunately, and the lack of access to care, we tend to see a lot of patients with diabetes to make sure that their eye health is staying, as good as possible.
Diabetes can lead to blindness.
It can, yeah.
Okay.
So, however, regular screenings can minimize that risk down to less than 90%. So, with screening, your chance of vision loss is less than 10%.
Okay, as long as you're taking care of it and you're being a compliant.
Be seen, control your blood sugar, control your blood pressure, and get in for your yearly exam is super important.
Yeah, absolutely. Yeah. Well, I think this is a good place for us to take a break because when we come back, Doc, I really want to talk a little bit about the cataract surgery. We've been asked to also address LASIK surgery. That's become very popular as well. So we're going to take a quick break. When we come back, what really happens during LASIK and cataract surgery, Dr. McNutt pulls back the curtain, and trust me, it's not as scary as you think it is. So don't go anywhere. Morning Brew is coming right back. Welcome back, everyone, to Morning Brew. We are talking to Dr. Stephen McNutt. He is an ophthalmologist. We've got a very fascinating conversation that we've been having with him. We've talked a lot about the blue screen and eye strain with all the scrolling. Then in our second segment, we talked a little bit about diseases and how getting a regular eye exam can lead to diagnoses that, if caught early, can be treated, such as diabetes and high blood pressure. But now we're getting into some really juicy stuff. We are talking about LASIK surgery and cataract surgery. And of course, it's something that Dr. McNutt is very familiar with. You just recently opened up a surgical suite in your clinic. And I think the last time that I went over there, we did a news piece with you. It was under construction.
Yeah, it's been a long road.
Yeah,
it's
I can imagine.
It's been open for about a year now. And
really?
Yeah, we got our joint commission credentialing too, so everything is on like super high level standards. So
I can imagine.
Yeah.
I definitely need to go back and get a little tour of that. So you were mentioning, of course, diabetes. We have such a high prevalence of diabetes here along the border. Cataract surgery, LASIK surgery. Let's talk about the two of them, because that is something that we hear a lot about. So dive in.
Thank you. So basically, both are ways that you can minimize the need for glasses. And so if you think about LASIK surgery as a refractive surgery, the goal is to focus light correctly without needing glasses. And so cataract surgery can do the same thing. In the past, cataract surgery was mainly about somebody having a dirty window, and I'll show a little bit more about this, and removing the dirty window and then getting them back to using glasses. But now the technology has advanced such that we can cut down people's need for glasses with cataract surgery too. So
the only thing that I know about cataract surgery, and please forgive my ignorance, is when you see the little white thing that's on top of the eye. I've seen it on older pets when my dogs.
I don't know anything about veterinary ophthalmology.
I know, but that's all I've known, and that you can remove that from the eye.
We're probably talking about a pterygium. So let me back up. So a cataract occurs when the lens that's on the inside that sits behind the pupil becomes cloudy. And so when it does, you can imagine that if you have a cloudy lens and you're trying to see through it, it's like looking through a cloudy window.
Wow.
And so in cataract surgery, and that lens looks like an M&M. And so in cataract surgery, what you do is you open the shell of that M&M, you remove the milk chocolate center, and then you put a new clear lens that looks kind of like this in its place. And so that surgery usually takes about 10 to 15 minutes.
That's it?
Yeah, it's pretty quick.
Wow.
It's done, obviously gracefully.
People are so apprehensive about any kind of surgery that's going to mess with your eye. Is it as scary, though, as people are afraid?
I think it's absolutely reasonable to have a healthy respect for surgery, because it is your vision, and I think it's the most important sense, but obviously I'm a little partial. So yeah, it's normal to have, to be apprehensive about any surgery, especially the eyes. It's something, again, that we spend a lot of time training for and honing our skill set to give good outcomes, and I think we do that.
Okay, so cataract surgery basically, once again, puts in a clear lens in place of the cloudy lens.
So we take out the cloudy window, and then we put a new clear lens in its place, and that focuses light correctly.
Go ahead.
I think what we were talking about is pterygium, a cataract is not like a tela. It's not something that just grows over your vision. A pterygium, or carnosidad that people call it around here, is a covering of tissue that grows on the outside of the eye from sunlight. And so here in Laredo, we obviously have a lot of sunlight, and that affects a lot of people. And so that's a different surgery, maybe what your dog had, that helps to clear up the view as well.
And how does the cataract happen? Is it because of sunlight? Or?
I think so. Yeah, it can be. A lot of factors do it, but mainly it's age. And so with time, the proteins change, and what used to be clear to light is not anymore. And so the light can't get through, and so it blocks the light from getting to the back of the eye, which is the retina, which is the film of the eye.
Because it is kind of age-based, is everyone going to get cataracts at some point?
Most people do. So you can have a cataract and it not affect your life. And so if you're doing well and you're seeing well with a cataract, I tell people you just live your life. And it's when it starts to affect your activities of daily living and you can't do the things that you need to do, or it's not safe to be driving or walking around because you can't see, obviously it makes sense to remove the cataract.
Now, will they happen in both eyes or maybe just one eye over the
Good
other?
question. Yeah, they typically progress similarly in both eyes. And I always take pause when I see one that's worse than the other because you want to make sure that something like trauma hasn't happened to that eye because that makes surgery significantly more difficult.
Okay. But the whole thing is about, you said 15 minutes to remove. And is it
Correct.
painful?
No. So nothing in life is 100%, but we do everything that we possibly can to minimize any pain. And most people say that they didn't even realize that it was being done. So
Are you awake during the procedure?
that's also a good question. Most people are. Yeah. So we give you some sedative either by mouth or through the IV, and that tends to calm people down. I would say half of my job is making sure that people are comfortable, and that includes just talking to them and keeping them calm while I'm doing the surgery, and half of the part is doing the physical surgery.
Okay.
Yeah. So that's a bit of an art too, I think.
Is after having the surgery done, the cataract surgery done, is it guaranteed? I mean, will the cataract go away is what I mean.
Once you get the cataract out, it's good for life. Some people can get a second cataract, which is not really a cataract. It's just a film that's grown behind the lens, which we can clean up in office. But once you've had cataract surgery, as long as everything looks good, it's not coming back,
Okay.
which is a beautiful thing.
Yeah.
And so one of the things that we can do with cataract surgery is cut down the need for glasses. And again, once you do that at the time of surgery, your vision should be like that for the rest of your time here on Earth. Yeah.
Now, will you be able to see the way you saw before, or will you see better after that?
That's a great question too. What I tell people is our goal is to get you back to about how you were seeing when you were 40 years old. So nothing's perfect. The lens that you're born with, when you're born, it actually changes shape. And with time, I'm getting there now myself, you have trouble seeing up close.
That's when you need reading glasses.
Correct, yeah. And so that lens stops being able to change shape to focus up close. And so when you have cataract surgery, the lens that gets put in can't change shape. And so it can affect the near vision. And so we have ways and tricks to help give people near vision at the time of surgery, but nothing's as good as what you were born with.
Okay,
Yeah.
great. Well, let's switch over and let's talk about LASIK surgery.
Sure. So just like we were talking about with cataract surgery and our ability to cut down the need for glasses, LASIK can do the same thing. And instead of working on the lens, which sits behind the pupil of the eye, LASIK changes the shape of the cornea, which is this outside clear dome on the eye. And by changing the shape of it, it changes how light focuses. And so that helps to cut down prescription too. Again, it's about the same amount of time, 10, 15 minutes, to cut down the need for glasses, which is great. I had LASIK and it was life-changing for me.
Yeah, I can imagine. Does everybody qualify, or some people don't qualify? Or?
Also a great question. Yeah, not everybody qualifies, and there's things you want. Anything that a doctor does should be safe at best, and so, or at first. And so coming in, getting a good evaluation to make sure you're a candidate for LASIK and cataract surgery for that matter is super important. There are some people that are not good candidates for LASIK, and there are other options that can help cut down the need for glasses in a patient that's not a good LASIK candidate, something called ICL.
I was going to say, who is not a good candidate for LASIK?
So it depends on the amount of cornea tissue that you have. You can't obviously shave away all the cornea because then you wouldn't have a cornea. And some people's cornea, that outside shape of the eye, are just not safe. The structure of that tissue is not safe to have LASIK. And so in those patients, there are some other options. And ICL, which is a lens that we can actually put in the eye behind the pupil and in front of the natural lens is one option to do that in patients that aren't a good candidate for LASIK. And same thing, about the same amount of time to cut down their glasses prescription.
Well, and that's what I was going to ask. The other procedure, does it have the same amount of level of not being able, or not having to wear glasses afterwards?
So there's a different range. ICL tends to be for people that have more prescription. So it's actually a more powerful treatment than LASIK typically is as far as cutting down the need for prescription. So in patients that weren't a good candidate because they had a really strong prescription, ICL may be a better option for them.
Okay. Now, LASIK is not covered by insurance because it's a
That's correct. It's
yeah.
a refractive surgery. It's like
Yeah.
it's like cosmetic surgery. Where
That's
it's
what
not
I was going
covered
to
by
say.
insurance.
Cosmetic,
Yeah.
but completely life-changing.
I think so. I mean, I had it and it helped me out a lot.
Yeah. Just nice not to have to worry about glasses and
Most
being able
definitely.
just to.
I couldn't tolerate my contact lenses, and I was playing hockey, and not being able to see when somebody's coming
Yeah.
at you is dangerous. And so yeah, it was definitely.
I would think you wouldn't have teeth or a
Yeah,
nose.
exactly.
Or,
Fortunately,
you know.
I kept those. Yeah, yeah.
Yeah.
But
Wow.
yeah, no, I think for the right person, LASIK's not for everybody. Cataract surgery may not be for everybody, and ICL surgery is not for everybody. But for the right person that's looking for something like that, there are options, and they can be life changing for the right person.
Wow.
Yeah.
Well, I do want to go back to, we are a very underserved community here in Laredo and in South Texas in general. So you recently opened up a surgical center, and that was because you saw the need or the lack of what we had here in Laredo. But you're up and going now, and tell us how it's been this last year.
It's been great. Our office has had a lot of changes. Building out the office-based surgery center is one of them. And again, I think it's a way for us to provide to the community. We're also bringing nurse practitioners on to help with the volume and with the screening of diabetic patients and such in town, which has been, it's different, but it's been really good. And Aaron, who works with us, is just amazing. And we're actually hiring another one here soon just to help out with the volume, because we are underserved. And so our goal at the office is to help bring care to people that need it. And so we're kind of blazing new trails to figure out the best way to do that.
Yeah.
So,
How many ophthalmologists are we now here in town?
I don't know. Yeah.
It's a very small number.
There's supposed to be one for about every 10 to 20,000 people, which means that Laredo could have, 12 or 15 or 25 ophthalmologists. And so we definitely don't have that. And so we need help. And so that's, again, part of the reason why we're trying to blaze these new trails and have our nurse practitioners help out in the clinic too.
Yeah. Well, we thank you very much for
pleasure.
being here in town, and you stuck around. You've been here for a while, and it's every time we see physicians here, and we just can't thank y'all enough for staying in town and providing much needed services, especially when it's such a niche, that we just don't want to be going out of town to get treatment for.
I appreciate you saying that.
Yeah, we
thanks for having
appreciate
me.
you. Thank you so much, Dr. McNutt. It's been a pleasure
Likewise.
learning about all of this, and keep doing what you're doing. We thank you for that.
Thanks.
And that does it for this episode of Morning Brew. If you know anyone out there who wears glasses, that hasn't been to an ophthalmologist for their yearly exam, please share this episode with them. It could be definitely life-changing for them. So with that, thank you so much for tuning in to this episode of Morning Brew. Until the next time, enjoy the brew.